Thank you, Ceann Comhairle. Taoiseach, in the programme for government, some very clear promises and commitments were given, following on promises that were given in the general election, that universal primary care will be introduced in phases so that additional doctors, nurses, other primary care professionals can be recruited. Access to primary care without fees will be extended in the first year to claimants of free drugs under the long-term illness scheme at a cost of 17 million. Access to primary care without fees will be extended in the second year to claimants of free drugs under the high-tech drug scheme at a cost of 15 million. And so on. Access to subsidised care, access to care without fees will be extended to all in the final phase. These were clear promises and commitments given. Phase 1 has not been delivered. Taoiseach has missed 2 deadlines and now has been abandoned altogether in terms of people on the long-term illness scheme. And what that brings to mind really is that last year, when we had the debacle over the primary care centres, the then Minister Roisin Shortall said some fairly hard things about Minister Riley's commitment to primary care. She has been proven correct. Even though she was forced out of office, she knew what she was doing in terms of delivering primary care. She got no support from the Minister at the time, or indeed from you or your Cabinet colleagues, and she was forced out of office for calling it right on that occasion. Now, when she said that, and when she said that the money had been taken by the Senior Minister and used for other purposes across the health services, she was quickly rejected by Minister Riley. And I'll give you his response, Taoiseach. He said, and I quote, on the 8th of the 10th, 2012, "No," he said, "the money is there and it will be brought in. The scheme will be brought in before the end of the year. Absolutely," he says. Absolutely, he said, unquote. Now, he clearly wasn't telling the truth then, Taoiseach, because there's no legislation has been published, no talks with the IMO have been initiated in terms of the contracts, and there's been no delivery of the promises. So why make promises, Taoiseach, again and again and again on this issue, only to break it again and again on this particular issue? And the Labour Party is still facilitating this and providing cover to Minister Riley and the government. And now Minister of State White, we have been told, is wandering the offices of government buildings with instructions to go and do research on other strategies. Taoiseach, with the health insurance system falling into disarray, waiting lists going up, this debacle now in terms of the free GP care, what actually has to happen, Taoiseach, for you to realise what your Cabinet colleagues privately acknowledge and what the rest of the country has known and understood for quite some time, that Minister James Riley is not the man to lead one of the most important departments in this country?
Well, you remind me of what you said yourself many years ago, when you said it takes longer to get things off the ground in health than in any other government department. You're quite right. And I saw the story this morning. About the free GP care for those on long-term illness. Now, Minister White is dealing with this matter very effectively, and actually what the Minister has done here is to look at the situation and, if you like, take a stock-taking view of what has happened and what needs to happen. Now, it's important to say to you, Deputy Martin, that the government is fully committed to delivering free GP care in its first term of office, as set out in the programme for government, and that no decision has been taken to go back on that. And it's important to remember that ultimately the entire population will be covered by free GP service. But I would say this to you, that when Minister White came before the Cabinet subcommittee dealing with health recently, he pointed out that it would be necessary to introduce complex legislation to provide free GP care to those on long-term illness. Now, let me finish now. Let me finish. The minister made a very valid point here, and what he pointed out was this: that the legislation that would be required to deal with free GP care to persons on long-term illness obviously would have to have a legal basis for eligibility, and that eligibility was based principally upon means, that is, income and residency. The legal framework for eligibility under the first phase of free GP care would be based on a medical condition, and that first phase would require a new legal and administrative arrangement, setting up doctors' panels for assessment of eligibility of the persons on long-term illness in the first place. And what Minister White pointed out was that he would be far more effective in looking at the longer strategy here, in implementing the rollout of free GP care beyond just that sector dealing which has long-term illness, because you'd have to set up a bureaucracy to deal with the assessment and the requirement for determining eligibility for free GP care for persons with long-term illness. So what he said was, I want 6 weeks to look at the entire scheme here and report back by the end of May, because what he's validly pointed out is that it's not effective to put in place a legal, administrative, bureaucratic assessment system for a sector with long-term illness for free GP care, and then have to move on to the other sectors. He said, I want to look at the entire scheme, and I support him in that. And he will report back, Deputy Martin, to the Cabinet Subcommittee by the end of this month with a view for the longer-term, more effective and less costly administratively rollout of free GP care, ultimately to cover the entire population. So the story that I read today in the national newspaper is in the main accurate, but it doesn't say what the government have not done here. The government have not made a decision to end free GP care. What the government have done is authorise Minister White, at his request, to look at the longer view here, more effective appraisal of the entire scheme, rather than focus on legislation dealing with one sector, which would require a legal base, an administrative setup, a bureaucratic system, and panels of doctors for assessment of eligibility on medical grounds for those who would be covered. So I support him in this. I think it's a valid stock-taking exercise by a minister who is taking into account the longer scheme here.
I don't know why you ask a question. Sorry, Deputy. I don't know why you ask a question and then don't listen to the answer. Some people in the chamber would like to hear the answer, not the mumbling that goes on in the background. Now, would you please allow Deputy Martin to ask a supplementary, and then we'll have a reply uninterrupted from the Taoiseach.
I'm simply with my colleagues on this occasion at Cloncola, and I agree 100% with you.
I don't agree with it.
But I know you don't.
I have to be in the chair.
The response is something like that. The response is very much like that sort of logistical, logarithmical progression or regression when Minister Early was before the House to do with primary care centres. That's an extraordinary reply, Taoiseach. I commend you on managing to give a reply to an answer questioning you on Minister Riley's suitability to lead the Department of Health without once mentioning Minister Riley in your reply. You mentioned Minister White about 15 times. Minister White is now saying it's very, very complex, that he has the legislation governing eligibility and so on like that. But again, I've got to remind you what Minister Riley said last year, October, in response to former Minister Shortall, who called this last year, Taoiseach, for you and for the rest of the Cabinet. She said there was no commitment to the primary care commitments in the programme for government. She was forced out of office. She got no support. Now, he said in response to that in October, no, he said, the money is there and the scheme will be brought in before the end of the year. Absolutely. That's Minister Riley saying this. Nothing about complexity, nothing about eligibility difficulties.
Could you have your supplementary,
and so on, and so on. And he made that promise, Taoiseach, about 5 or 6 times in the last 2 years, because he's been questioned repeatedly by journalists, by opposition spokespeople, by Deputy Kelleher here and Deputy Quayle and others in relation to the progression of this particular commitment and promise that was made. And up to very recently, he was denying all comments or statements to the effect that this would not be delivered and would not go ahead. And now you're saying that Minister White has taken charge of the whole debacle, and you're saying that he's dealing with it effectively. Dealing with it effectively, in your words, Taoiseach, is 2.5 years on, 56,000 people who were on the long-term illness scheme, who thought they were going to have free GP care in year 1 of your government, are now being told that for them it has been abandoned, that particular commitment has been abandoned and will not proceed. That is how you describe and define dealing effectively with a promise solemnly made by you and Minister Riley. And I repeat again the question I asked you that you avoided. What has to happen for you to realise what your colleagues privately acknowledge and the rest of the country has understood for quite some time now?
Thank you,
that Minister Riley is not the man to lead the Department of Health and Children.
Taoiseach.
Well, you make a comment and you ask a question. Minister Alex White is dealing with the area of primary care. His appointment to that department has allowed him to focus on an element of the scheme for the introduction of free GP care for persons with long-term illness. Now, Minister White quite rightly looked at the requirement for legislation in that area to deal with eligibility on medical grounds and to deal with the administrative requirement to assess those patients. Previously, they've been assessed on income and on residency. In the long-term free GP care scheme, it will be based on medical assessment and medical grounds. And Minister White reported officially and formally to the Cabinet Subcommittee and said, this is not the way to do this piecemeal. I want to look at the entire scheme. I want 6 weeks to come back to this Cabinet Committee and say, am I able to do this more effectively for the entire scheme and progress it more effectively? And we gave him that authorisation, and he will come back and report on his view of how it can be done more effectively. Let me assure you, Deputy Martin, and those 56,000 people that you refer to, there is no question of the government abandoning its commitment in the programme for government for free GP care for these citizens and ultimately for the entire cohort of the population. In respect of your question about Minister Riley is a Minister for Health. He has my full support in the strategy and the changes that are necessary to bring about a more effective health service. As you yourself quite rightly pointed out, when you had that responsibility, it takes longer to get things done in the Department of Health than anywhere else. And that's the requirement to change the structures and the effectiveness of delivery of services in the Department of Health that Minister Riley is focused on. And primary care is one central element of that, and that's being handled very effectively by Minister Alex White.